Dr. Bruce Lee sits in his office speaking to the camera. Bookshelves filled with books and framed items line the wall behind him. Close-up footage highlights personal objects reflecting his cultural background and military service.
I'm Dr. Bruce Lee. I'm an orthopedic surgeon. I speak Vietnamese and Spanish. I spoke French when I was a kid because it was Vietnam. I was born in Vietnam. I left when I was 7 years old. We were a few days ahead of the North Vietnamese Communist Army, and our first night in this country was spent at Camp Pendleton. First time I was ever so cold that I needed a blanket. In Vietnam, we didn't need blankets back then. I grew up in Southern California. I grew up in Torrance. Then I moved to Los Angeles and matriculated to the University of Southern California, and that's my alma mater. My practice is orthopedics, but I am trained for sports medicines and shoulder surgery in particular. I went to medical school in Pomona at the College of Osteopathic Medicine in the Pacific. Then I went into my internship in Michigan, and I did my residency in Philadelphia at PCOM and at the Graduate Health System. Upon the completion of my residency, I was activated into the U.S. Army, mostly at Fort Benning. I was deployed to Europe for Operation Allied Force. I had the privilege of being deployed and helping our soldiers. Great experience, great people, and as an immigrant, I felt like I earned my citizenship. As an orthopedic surgeon, we do take trauma call. We fix their problem, we replace their joints, we fix their shoulders, but we also take care of them later on, such as when they tear the rotator cuff, or ultimately, if their joints are destroyed, we can replace it. My particular area of specialty is with shoulders. The shoulder is one of the most complicated joints in the body. It is highly mobile, but it also highly unstable. I'm also involved in education. I am a professor for UCSF. It is one of my great joys is to be able to teach these residents not only the techniques but the philosophies involved in taking care of athletes. We are team physicians for several high schools and for COS. So we run through hundreds of athletes and help to clear them for their sports physicals. I also enjoy traveling. I've skied from Calgary all the way down to Southern California. A couple years ago, I was able to take my family back to Vietnam, where I was born. It was surreal to go back to the same war-torn country, which is now a vibrant economy and a vibrant country. I remember as a kid driving by the presidential palace, seeing how great and grand it was, thinking how neat it would be to walk through it. And sure enough, 40 years later, I get to visit the old presidential palace in Saigon, Vietnam, with my family, and it was certainly surreal and a fantastic experience. As an orthopedic surgeon, we are in relative high demand throughout the country. But when I visited here, I liked the small town feel. I liked being able to walk down the street, run into a patient and say hello. And I felt very much wanted and felt needed here. So one of the most important questions I ask my patient is, what would you like me to do for you? What are you looking for? What do you want? And that's part of listening to the patient, trying to understand what they're looking for. And so whether or not it is a wealthy patient or the poorest patient, you treat them all the same. You want that cashier at the store to have just as good a result as that dairyman you took care of. So you treat everybody the same.